Good afternoon. Unlikely, I'm the one standing between you and your lunch. And I know I'm an obligation to be very short. What I'm going to say, I'm not going to repeat all the good words that came after the presentation, the nice presentations that came from Mary's, from Wi-Fi, from Yemane. The network did a lot. In 10 years' time, we have achieved a lot. We address a lot of health risks that adolescents are running. And I'm not sure, from the perspective of the PIs, that what I'm going to say will be different than what we started already to do. Because already we have a good momentum of the activities that we are running with this network. But what I would like to add is that we need to consider the change that is happening. You know, adolescent health has a lot of hiccups, going from rural area to urban area. And there are a lot of changes that are coming currently. And urbanization is coming very quickly. And today, this was in 2018, United Nations estimated that 55% of the world population are living in the urban area. And this is supposed to be 68 in 2050. And most of these people are adolescent. And despite all this, only few health funding is going to adolescent health. And this as a context that we need really to take into consideration. Another thing also that we need to consider is that adolescent is a unique period of life who is going between the childhood and the adulthood. And it's to lay the ground for the healthy, good health for the adulthood. And they are running a lot of challenges, going from mental health, physical activities, sexual and reproductive health, health service delivery and utilization, substance abuse, gender-based violence and injuries. So to say that there is really an urgent need to tailor currently the health program and policy on key adolescent health to really make an impact. So from the PI's perspective, I would like to mention, from my view, 6 points. These are not new to the network. It's for somehow areas where we need really to reinforce what we are doing currently. So the first one is that improving the evidence-based intervention on adolescent health are critical, and WHO is behind this. So we have support for this. We are already on the track, and we need really to push. There is also a need to generate a new longitudinal and nationally representative data, because we want our research to really make impact on our nationally and also globally. So we need to have really comprehensive data that help us to advocate with the policymakers. We need also to look at the delivery platform, the integrated delivery platform. We need really to validate this delivery platform. Most of people before me talk about the capacity building. The capacity building is key on what we are doing in ARISE network. We need really to train a critical mass of scientific new generation training, and we are very glad that this is one of the main goals of the network. And currently we have opportunities that are new technologies coming. We have AI, we have all these smartphones that we have in hand that need really to be put in contribution to develop intervention for the adolescent. And we need really to provide strong basis, scientific basis on high impact intervention for policymakers to pick up. And how do we get there? Because these are things that we are already doing. Some we are perfectly doing it, and for some we need really to keep on pushing, improving what we are doing, and adapting what we are doing to the local context. To get there, we need really to strengthen the network. I'm glad that today we have 20 research institutions that are part of the network, 10 countries, which is really an achievement, but we need still to expand the network to other countries. And specifically standing here, I will advocate for French-speaking countries. We are not a lot in the network, but I think it's value to have French-speaking countries also to join the network. We need to continue the capacity building because this is critical. To achieve really the adolescent health challenges, we need to train a critical mass of scientists to be able to tackle these various issues. There are a lot, and we need to be innovative and creative to make use of all these new tools that are available for our research activities. And what we are doing here, I'm very grateful for the think tank that we are launching today. We need to build a strong policy link to keep the policy dialogue to be continuous so that we will be making impact. We are already making impact, but we need to make more impact related to adolescent health. And finally, last but not the least, the adolescent. The adolescent need really to be well involved on all the activities. They have to be in the center of these research activities because we are doing something for them. We cannot do this without them. So they have to be in the driving seat. They have to feel honor of what we are doing, and this is the way we will be achieving what we are planning to make a big impact on adolescent health. I would like to thank you with these words, and enjoy your meal.